Bethany TV for health.
A very good evening to you all wherever you're watching Bethany TV from. Welcome to Medical Minds. Today is a very interesting session as we've been running it down. We're going to have question and answer session. Today we're going to have two doctors in the studio, one to help us with English and the other one ajja tuyambako mu Luganda. Nga nabagambye jjo Luganda lwange si lulungi nnyo, but I'll always try and make sure when nsobola nga tubyogera mu Luganda. Wherever you're watching Bethany TV from, welcome. It's already 8 p.m. I'm in the studio together with Dr. Pili and Dr. Nsenga Joseph, who is almost going to say hello to you in a few minutes' time. So let's start the show as we take you through the entire questions that you've been sending us, right from journey to motherhood, from Medical Mind, from health and wellness, whatever. We are here in the studio to start off the show. Good evening, Doctor.
Good evening, Teacher Zita.
I'm so privileged to host you today.
I'm so glad to be here.
Thank you. Welcome. Please say hello to everyone who is watching us this evening.
Hello. I'm glad to be in the studio with Teacher Zita to answer your questions. My name is Dr. Pili Patrick. I'm a gynecologist, fertility specialist. I work with Bethany. I mainly sit in the Entebbe branch.
Okay.
Yeah.
Thank you. Thank you, so, Doctor. You said you specialize in fertility issues. Yes. Very good. Yes. Let's start from there. Are you good at Luganda?
Well, I see many people who speak Luganda, but on the show, I think it will be complex.
It will be complex.
I would prefer to use English.
English best.
Yes.
No worry, no worry. Doctor, we've been running several topics, several lessons. This is like a class. Okay. With Medical Mind, it's a class. Just that in our class, we don't do exams. Yes, we listen, we write, we interact, and we revise, we do corrections, but no exams. Today, we are going to have questions and answer sessions. If you're watching us, please prepare your questions. You're free to call even right now. You're free to send the messages on the numbers running on the screen, and you ask us what you want the doctor to answer you. If it is in English or Luganda, I will translate it to doctor. Doctor will translate it in, speak it in English, then nenduza mu Luganda when answer what day. So we've been Aganda, but also Lagana, of course. We have experts around who can always help us get whatever that we want. Let's start off, Doctor. We are going to start with, since it's your area of specialization, fertility in women. Let's talk about the educated mothers, girls, ladies, the corporate ladies. Someone goes to school, studies, graduates, gets a car, gets a job, does this and that. If they are lucky, if they are really lucky, they get married. But in most cases, they fail to conceive. If they are not lucky, they as well fail to get married. Yes, as a doctor. Yes, kindly help us explain to us that trend. Because we know every man would love to get someone educated, someone who is wealthy. True. But why do these mothers, why do these ladies always fail to settle with someone, to start up a family?
Thank you, Teacher Zita. It is what we call corporate infertility. Corporate infertility,
what's that?
The corporate class, the corporate woman, what women emancipation did. Soon we are going to be celebrating Women's Day.
Very soon.
We thank the people who came up with the idea.
Because all the days are for men.
Yeah, but many years ago, people who fought for women thought they needed to join education, they needed to join the working class, they needed to go to office, stop being homemakers and childbearers. And indeed, the world has embraced that part, and women went to the offices, they went to school. If you take, on average, a young girl going to school from primary up to university will come out of school when they are about 23 to 24, bachelor's level.
Or even 27.
Or even 27, depending on the course
they took. Because, for example, if they took medicine, it takes 5 years.
Yes. So, if they took medicine or any course which took them up to 27 years, they are going to come out, and before they know it, they are reaching 30. Because you have to find love and settle down. But there is a dynamic when they come out. They are educated, maybe at the level of bachelors or even masters. Now, it is very hard for women to marry downwards.
Downward, as in?
If a woman has a bachelor's degree, it becomes hard for her to marry, let's say,
a carpenter.
Yes.
Why not?
Who probably is not at the level of bachelors. A woman either, most of them will want to marry someone at their own level.
Or better than them.
Or better than them. But statistics have shown that for every educated bachelor, educated woman, the sample space for men are so few. And these men can marry downwards. A master's man can go and marry a woman who is not even educated. So this group of ladies find themselves in a fix. Say it's 27 years. Medically speaking, her fertility curve is beginning to go down. And by the time she wakes up, she is 30, 32, and she gets married, things start to fail. So this is what we now are coming to realize, the corporate kind of infertility. That the corporate woman is educated, has the money, she has made it in life, but the men are not there. And therefore there is that struggle which we are seeing. So we call upon the men, please, don't shy away.
They're not shying away. Perhaps it's we, the ladies, putting a lot of class.
Setting the bar so high.
Yes, surely.
Yes,
surely. Because,
teachers, you realize that it is strange that much as we have gone through women emancipation and society still wants to box a woman in terms of, have you had children?
Why are you not giving back?
Yes, a woman can have all the money. They can be CEOs. But society reduces them to, where is the child? Where is the husband? And the corporate woman finds it very hard to answer that question. She is probably taking care of so many people's children who are not even educated, but she finds it a big challenge. So we are telling the corporate ladies, the fertility curve keeps on going down, and therefore.
Hello. We have the first call on the line. Welcome to Bethany Medical Minds. Good evening, caller.
Good evening. This is Jennifer.
Jennifer, where are you calling from?
Luzira.
Please go on with your question.
Yes, I'm kind of inquiring. How is it with laparoscopy?
How?
Hello?
Yes, can you repeat that word again?
How much is laparoscopy?
Laparoscopy, okay. Laparoscopic surgery? Oh.
Yes.
Thank you so much, Jennifer.
Hello?
Yes, we are getting you well.
Because all aspects of come out negative. Everything they do is negative. So they told me the last time book for but I want to speak from doctor. I'm kind of how much it is.
Thank you so much, Jennifer. Thank you, Jennifer. Though there were some few words breaking off, but yes.
She's asking about laparoscopy surgery.
Yes, she's asking about. I think she has done certain tests. I think to help out with something, but I didn't hear that word well. Yes, and she's trying to ask how much is that laparoscopy surgery. Yes.
I think maybe I should first, Jennifer, you said you moved to places and they told you probably your option now is laparoscopic surgery. Laparoscopy is a form of surgery where we don't cut people open.
How do you do it?
We use keyhole, we use small holes to introduce a camera into the abdomen. Then we use tiny instruments to operate inside.
Internally, you don't cut.
So we operate on TV, like we call it camera operation.
Oh, okay.
Yes,
okay.
We are able to operate someone by reflecting their body on the camera. But we don't use a big cut on the abdomen. So that is the kind of what we mean by laparoscopic surgery or endoscopic surgery in medical terms.
Okay.
The advantage of laparoscopy is that it's like you are introducing a magnified eye into the abdomen.
Okay.
You are seeing finer details. My eye and laparoscopic eye. Laparoscopy magnifies many more times.
Laparoscopy comes from telescope?
Yes.
Oh, okay.
Yes.
Okay, that's good.
Yes, it magnifies many more times the disease than if I looked with my open eye.
It helps you to see better.
Yes.
Very good. So
and
how much?
The advantage is we can do a lot in your reproductive system without you having a big wound on your tummy.
Okay.
Many women want to go to wear a bikini and go to the beach. So laparoscopy helps you to solve your problem. You have fibroids, you have cysts, you have all these other problems. Laparoscopy can help to operate those diseases without cutting you.
Okay. Thank you.
Yes.
And how much can it cost? That's what he's asking.
It depends. What I would ask my sister is, just like every disease, the cost depends on what exactly the disease is. Right now, she said she did test, but we don't know the condition. We would encourage her to come and consult a doctor in Bethany. Consultation, I know she probably will afford between 70 or 80 and engage us.
So that you find out exactly what is
we find out exactly what the condition is. And the advantage is, it's not like when there is a problem, you need surgery, we are going to take you to theater now, unless the emergency. But this is something which you can plan for. Many people think laparoscopic surgery is so costly. No, but we can do laparoscopies from 3 million and above. So really, it is within the means of so many people to afford these surgeries.
Okay.
But we ask her to come and engage us. We look at the problem and we address that problem.
Thank you so much, Jennifer and Doctor. Jennifer, I think you've got doctor. Get time and go to the hospital and they find out what exactly is supposed to be done so that you can know the cost. Because for now, you didn't specify. Maybe if you told doctor what exactly is needed, he could have advised accordingly. Doctor, as you were still explaining to us, we stopped somewhere where you were advising us ladies to, much as we study, we should also look at our fertility. Yes. And the other one, we have messages that last week we didn't attend to. We are going to read them for you, then you help us as well to answer them. Yes, the first one was, good evening, Beth and TV. My question is, my cycle is 28 days, but for now I take 33 days. What could be the problem? This is the first question that we've carried forward last week. Yes.
So maybe as you look for the other questions, I can. The menstrual cycle of a woman is a range.
Okay.
It's not a fixed figure. Normally we say if a woman's cycle is between 25 days to 35 days, if it fits in that gap, we consider it to be a normal cycle.
That is from
25 days
25
to 35.
To 35
if your cycle month in, month out fits within this paradigm, yes. And more specifically for a particular person, if your cycle fits within, let's say, a 3 to 5 day margin, it is well.
So she's safe.
Yes, so if you have 28 and now you go to 30, you are safe. Yes.
That's
so unless the challenge is many ladies connect fertility with their cycle.
Because we don't know.
Yes.
Yes, we don't know that.
So if you have tried to follow your cycle 3, 4, 5, 6 months and things are not working, please get in touch and we understand. The fact that you have regular cycles does not necessarily mean you will be able to have children. So you might have regular cycles every month on the dot, but there can be other issues.
So in other words, before a mother or a woman gets pregnant or prepares their bodies, there are certain tests they should take to ensure whether they're fertile, whether they're able to conceive, or there's any challenge with their bodies.
Well, there's a mantra we use in the fertility cycle that the best test for infertility is trying.
Oh, really? So let's keep trying to see whether we are able or not. Thank you so much, Doctor. Another question. Good evening, Doctor. Can someone get a remedy for a thickened uterus that has prevented conception? That is still in your area, fertility. Yes.
When you say, thank you so much, when you say thickened uterus, are we saying, is it fibroids? Are we saying adenomyosis? These are conditions which can make the uterus, we call it bulky uterus. I know probably she did a scan and they said the uterus is bulky. Or if she's saying thickened, meaning the endometrium, the inside where the baby is supposed to attach and grow, what we call a thickened endometrium or hyperplasia in medical terms, there are conditions which can cause this problem. And it only takes, if it is again affecting her ability to conceive, we are now saying that these services are here in this country. You can easily get in touch with Bethany team and other fertility centers. Come. The challenge, teachers, that we have here is waiting. WHO recommends after 1 year of trying to conceive with your partner, and if you are staying together or you are meeting regularly and you're below 35 years, after 1 year of trying and things are not working, please come to hospital. If you are above 35 years, after 6 months of trying, please come to hospital. But right now we are doing a study, and the preliminary findings are that people come to hospital after 5 to 6 years. That is the mean. So if someone got married at 35 and they have waited up to 40, they come to hospital. We run things and we see the egg reserve is going down.
Going down.
And so we are saying, if you desire to have children and 1 year of trying to have children, things are not working, please.
You should take a step.
Yes.
Thank you so much, Doctor. Good evening, Doctor. I have a sister with high blood pressure, but they told us that the high blood pressure is because of the fibroids she's having. Doctor, what would you have to say about it?
I'm yet to find a connection between high blood pressure and fibroids.
And fibroids. Well, she didn't indicate whether the sister is expecting or not. It is open. It is an open.
Yes, maybe there are new studies, but for now there is no direct relationship between. Maybe there are two conditions existing together. Someone can be having high blood pressure independent of the fibroids. So it is not like the fibroids are causing high blood pressure.
Okay.
So those two are quite independent.
Thank you, Doctor. This is Joel, and he's saying thank you for the show. I have a sister, I think this is the same. I have a sister who was failed to conceive for 2 years now, and she's at the verge of divorcing. What can she do, Doctor? This was still last week.
Yes. So that's what I was trying to say.
Yes, yes.
You are married. 1 year down the road, things are not working. You need to get in touch. But this advice goes to men. You see, if you get married to somebody and the two of you are having challenges, it is upon us, the men, to take the initiative to support the women. We are seeing so many women financing fertility treatments. They come to hospital, they're the ones to pay for the bills, they're the ones to finance.
Because they want pressure from the husband.
Yes. Finally, when they get the child, like with minimal support from the man wants to say, let the chica give the name. They now want to be all over the child.
Part of the journey.
Yes. They want to take over the process now. But we are saying it takes two to tango.
Surely.
If most men, when their woman is having a challenge, instead of helping the woman, they go sidebar.
Okay. Sorry, doctor, as we're still explaining, someone is on the line. Someone is calling in. Bethany TV, good evening.
Hello.
Hello.
Thank you for the show.
You're welcome.
So I have a question for the doctor.
You have a?
The question for
Doctor,
me.
I have a question.
Oh, yes. Go on. What's your name?
My name is Bonnie.
Alice?
Bonnie Damasoba.
Okay.
Yes, so my question is, so we've been treating infections for almost months, but I have going away. What should we do?
Thank you.
Yeah.
Thank you so
Thank
much
you.
for calling, Kylie. She has been treating infections for months, but they're not going. Yes. You are still finishing something? Oh, we're done.
Yes. About the,
then we'll look at the infection
the
bit.
issue of my sister who's saying they're about to divorce. So, when people are getting married, it is not written on their face that, Dr. Pili, you will be able to have a child with this lady. It is the two of you come together and you want to build a family together. So when a challenge comes, and it is a fertility challenge, maybe on the side of the man, women are so good. When a man has a fertility challenge, they stick around.
We are patient because
Yes.
we are God. God.
Yes.
Did you know that God is a woman?
Well, they stick around. They support us, the men, but men, on the other hand, are letting down women.
True.
So a woman has a challenge, and the man says, me, I give birth. I have a child in Tororo, Soroti, Gulu.
Not knowing sometimes it's not even there.
Yes, they are raising children for somebody. So we encourage the men. I personally, when I am doing consultations, I encourage the woman to come with their husband.
Sometimes they don't want to. They don't, because they think it is the woman who is infertile.
But they reach home, they are the decision
That they
makers.
don't have time. And then when you give birth, they say that the child belongs to the man.
Why I want men to come to the consultation room is a woman finishes consultation, goes and gives a reported speech. And ladies prefer giving headlines.
Yes.
They don't give news in detail. So so I would love the men to come and we discuss. And I can tell you, teachers, that many times when you engage the men, most of them have knowledge gaps. Their knowledge is from fellow colleagues. I say, take this, take that. So when we engage the men, the fertility treatment journey becomes easy and faster.
Excellent, doctor.
Yes.
Thank you so much, my dear brother who sent in this message. I think you've got it from doctor. Encourage your sister to convince the husband so that they can go together and find out exactly what could be the problem. Who knows? The man could be the problem. He could be the one carrying the problem, and they work it out together than, trying to pinpoint the wife. Another one, we're going to, pardon, we didn't answer the infection. Yes, unfortunately, time is going so fast. We're going to have a very short break, but please feel free to be part of us when we come back on air. Keep it a pair.
Bethany TV for health.
Health Minutes on Bethany TV. Self-medication is taking drugs, herbs, or home remedies on one's own initiative or on the advice of another person without consulting a doctor. Medicine is safe when the people who are using it have sufficient knowledge about its dosage, time of intake, and the side effects on overdose.
Medicines can be small poisons, remember? Whereas they can cure diseases, they can also be taken wrongly and they become poison. So disease from self-prescriptions, self-medications, or even sharing medicines. The symptoms for the body can look the same, but if you take medicines because so-and-so took them, they are feeling exactly the same way, the diseases may be different.
It is recommended to get a health checkup and to take medicine that has been prescribed by a healthcare professional according to the diagnosis made before taking any type of medicine.
Take that medicine according to the prescription from your trained, professional, licensed health worker.
Better healthcare for a better tomorrow. That was the Health Minute.
Are you looking for a platform to advertise your business and boost your sales? Bethany TV got you covered. Take advantage of our introductory rates and maximize your leverage for brand awareness, advertising, product launching, live coverages, activations, and so much more. For booking and more information, contact our sales team on 0785 576 269. Bethany TV for health. Exciting news for all viewers of Bethany TV. Bethany TV, the premier health TV channel in Uganda and Africa, and also your favorite TV station, is now on Star Times. You can now watch Bethany TV day and night, weekdays and weekends on Star Times, channel 271. Catch your favorite programs on health, wellness, entertainment, and so much more. Bethany TV is also available on free-to-air, GoTV, YoTV, Airtel TV, and Afro mobile apps. Not forgetting online via our website www.bethanytv.ug and social media platforms at Bethany TV UG. Bethany TV for health. Bethany TV for health.
From that break, it's still Bethany TV. In case you've just joined us, this is Medical Mind, and it's a question and answer session. Today, Dr. Pili is sitting in for Dr. Anabat, but nevertheless, we are still counting on and taking you through the entire answering session very well. Doctor, we stopped to where we were talking about an infection. This girl who called from Namasoba, and she said she has treated infection several times, but it's not going. What could be the problem?
Yes, thank you, my sister. There are two things which in my line of work which I have come across. Urinary tract infection. I think Dr. Charity talked about infections here at one point. Yes. Most ladies confuse urinary tract infection with vaginal infections.
Including me, but I learned that now.
Yes. So many times the urine just uses the vagina to exit.
True.
But it is not really there.
It comes from somewhere.
It comes from somewhere and just passes. So what people call I have infection is actually vaginal infections, candida, trichomoniasis.
True.
Discharge, what we call vaginal discharge syndrome. So many times they go to the hospital, you tell them, let's get that discharge from the private parts and analyze it. They say, no, give urine. And my colleagues in the field.
So there's a difference in the test?
Yes.
Okay.
So, and there are so many facilities who want to do the urine. They do the urine and nothing comes. Or the urine says, okay, pass cells plus this. So they give antibiotics. Now, antibiotics are again going to kill the normal flora within the vagina. You are propagating more infections. Because one of the causes of recurrent vaginal infection is continuous antibiotic use. So people start from injections to over-the-counter and a lot of antibiotics. So these antibiotics are continuing to kill the normal bacteria within the vagina. So you will continue to treat. So I normally tell them, if you're having a discharge, let them analyze the discharge, not the urine.
Thank you so much, Doctor. So please kindly get time and go to the doctors, just like doctor said, and find out exactly what you're suffering from. It could be a UTI or a vaginal infection, but the two look similar since they stay together. Yes, someone is asking that is vaginal infection curable, treated well?
Yes.
Okay.
Yes. Because if vaginal...
Is it preventable?
Yes.
How can you prevent it?
Vaginal hygiene.
Ah. Okay.
Yes.
We keep clean?
we keep clean.
Can you talk something small about the hygiene? Because
Yes.
that place is always far away, private. How does it get dirty?
How does the mouth get dirty?
We eat food, we touch.
Yes.
Yes, we chew gum.
The vagina is in between the thigh and closer to the anus.
Okay.
So bacteria can always migrate from the anus or from the thighs and move into the vagina.
Through the sweat, the dirt.
Yes, and this is, okay, the children will not listen to this, but people, when they're having intimacy, they don't first go and wash the other private part.
Most of them don't.
Yes, so they go when it is not so clean. So things enter there.
Thank you so much, Doctor. I think she has got it very well. Another question in here, still in your field. Good evening, Doctor. Thank you for the program. I'm Tawoda Bernard from Seta Mukono. What brings in pain in the abdomen, the elements, and what leads to loss of appetite to food by a pregnant lady? Loss of appetite, then lower pain, lower pain.
Okay, in the early forms or in the early days of the pregnancy, what we call the morning symptoms.
Yes.
Like most women are vomiting, they have appetite disorder. These are mainly hormone driven.
Okay.
When you get pregnant, a lot of hormones come into your system, and they indirectly, the body is trying to protect you from, because the first 12 weeks is what we call the developmental stage, the embryogenesis.
Okay.
So I think God knew that if you ate everything, it might go and damage the pregnancy. So hormones have come into place to try and be selective. You see, a woman is selective. You maybe eat particular things which the baby needs to make its system.
For that period.
Yes, for that period. So the moment the body realizes that the baby is good to go.
Thank you. That is an excellent explanation. I've been always wondering, why do we crave? Why do we? Oh, thank you so much, Doctor. Good evening, Musao. I'm Doreen. I'm asking, why do I always miss periods? She misses her periods.
Yes, now that's if it is persistent, that's a problem which we need to investigate. A woman is supposed to have periods every month. In a year, if really things go bad, probably once or twice, which can happen, but ideally you're supposed to have your periods. So you come, it could be hormonal imbalance. That is the commonest hormonal imbalance, which makes you to miss periods. So come, we see which hormones are not balancing. The ones which we can balance, we give you drugs and you are good to go.
Thank you so much, Doctor. Thanks, Bethan TV, for the show. Can family planning methods cause ectopic pregnancy? This is Patience.
Yes. There are a lot of myths around family planning, and it is causing havoc in society. But one thing, Patience, I can tell you is family planning, the way it works, depending whether it is IUD. IUD just works to make the environment probably hostile, or these hormonal ones, they prevent you from releasing eggs. So directly speaking, studies have not confirmed that family planning X causes ectopic pregnancy. Many people, however, when they use family planning, they become promiscuous. So in the process of family planning cannot stop you from getting STDs, maybe apart from condoms, the barrier methods. So they get STDs, which goes and affects the fallopian tubes, and in the process the tube becomes damaged. So remember, the pregnancy is formed in the fallopian tube before it comes into the uterus. So if it finds a fallopian tube that has potholes, let me make the infection like potholes, the pregnancy cannot move to where it is supposed to be. Okay. And therefore the risk of ectopic pregnancy.
Okay.
Yes.
Thank you. Good evening, Teacher Zita. Can a woman with one open tube use clomiphene citrate when another tube is blocked? Then is it advisable to conceive naturally if one tube is blocked and another open, or it increases risk of ectopic pregnancy? This is Prosi from Wakiso.
Okay, depending on what caused the previous ectopic, majority of ectopic pregnancies are due to infections. But we have seen so many women who have completed their families with one tube. Yes. Personally, I've delivered a lady 4 times with one fallopian tube.
With just one fallopian tube?
Yes.
Okay.
So you can go ahead. If you are getting pregnant with one fallopian tube, it is possible.
Thank you.
But the majority of them will have a challenge with the other tube because of the infection, and therefore the risk of ectopic increases.
Thank you, doctor. Another thing, I did a scan. They told me that I have a lot of eggs, but it doesn't grow up. What could it be, doctor?
Medically speaking, it is called polycystic ovarian syndrome. PCOS.
PCOS, okay.
Many people are now in
What is it?
PCOS.
If you define it.
PCOS generally means you have a hormone imbalance.
Oh, okay.
The hormone which is supposed to make the eggs to grow is less than the hormone which is supposed to make the eggs to come out. So therefore the eggs cannot grow, they get piled. And so every month the eggs are supposed to, in the body, a woman's eggs are like a tray. Every month the body picks one tray and
pours away? Oh,
yes.
Okay.
Technically speaking, picks one tray. Out of that one tray, one of them gets dominant or the most strong one, and the rest die. The next month it goes and picks another tray. So, and this is driven by hormones. So in a scenario where the hormones which is supposed to pick the eggs from the tray is not adequate, the eggs are going to sit there.
Oh, okay.
Yes.
So it's the hormone that is not doing its work.
Yes.
But the eggs are okay.
The eggs are there.
So how can she be helped?
So she needs to come and we see how unbalanced the hormones are.
In her body?
In her body.
Okay.
So that we try and balance the hormones and take them, like reboot the system.
So that the other one can do its work?
Yeah, so the other one can do its work and you have your children.
Thank you so much, doctor. That is interesting. I'm watching your show. Good evening. I'm inquiring how possible a lady whose womb was partially removed be a mother. Oh, wow, a womb.
The womb technically is used for carrying.
Carrying the baby.
Yes.
Okay.
There are people who have one segment of the womb together with the fallopian tube that has developed, and they are able to carry babies.
The womb is the Nabana in Uganda?
Yes,
okay.
yes, the Nabana. So it depends on what was left. For me, I'm more interested is the fallopian tube intact, because many people, I really want people to understand the primary thing you need to conceive in your system is the fallopian tube. The fallopian tube is where the baby is formed. It is the factory area where the system does the manufacturing.
Doctor, hold on. If a mother and a father meet, where does the egg go? Where does the sperm and the egg meet from?
Okay, so the sperms swim from the vagina. They go through the womb.
Past the womb again?
Yes.
Where do they go to?
They go to the fallopian tubes.
Oh, those
Yes,
corners that look
those
like
corners,
the ovaries of the
enseke.
flower. Oh, enseke. Okay.
They go into the fallopian tube. The eggs also come from the ovary. They enter into the fallopian tube.
Okay.
So the two of them have a meeting.
They discuss about their plans on how
Yes,
to grow.
yes. And they get fertilized. So that is where fertilization takes place. It is not in the womb, it is not in the ovary, it is in the tube. So the moment they get fertilized in the tube, the first nutrients for the baby are also in the fallopian tube.
So how many months or weeks does it take in that tube before it?
So technically it takes about 3 to 4 days.
Only?
Yes.
Okay.
In the fallopian tube. From there, now the baby that is formed comes back into the uterus.
Into the nirvana.
Yes.
That is where it's supposed to grow from.
Yes. So ectopic pregnancy happens when it remains there. It doesn't travel back.
Something obstructs it or blocks it from
something
moving.
blocks it. The fallopian tube has the brooms. The sperms and the eggs do not have legs. So there is a broom within the fallopian tube, within the reproductive system, which keeps on sweeping these things.
It sweeps it in pola and pola.
It sweeps it in pola and pola
Until
for
it
them to
reaches.
meet. And then once the baby is formed, it sweeps again in pola and pola for it to reach the womb.
Doctor, where do we find those brooms?
Within the fallopian tube.
Within the tube itself?
Yes.
Could that be the cause as to why some mothers fail to, like they conceive and then the babies fail to swim here, like they had scars, they had a lot of infections. When maybe those brooms fail to work, that is when the egg fails to travel back.
What we call functional infertility. Some people go and they see the fallopian tube is open. They do this scan, HSG.
It's normal.
It is open, but the broom is damaged.
So the broom also is a leading cause of the baby failing to come back here?
Yes, the most, actually I would call it the leading, because you can see the tube is open, but you are not getting pregnant. So the broom, which is like hair-like things, medically we call it cilia. When the cilia is damaged, the things cannot move.
So how can a mother get the broom back? Can it be?
No, there is no
So if you don't have a broom,
well,
fertility, nothing.
Plus the broom, there is also the muscular movement. We call it peristaltic movement. So you get lucky and the body tries. The body is a machine. It really wants you to get pregnant. But once you deprive its ability, if you get infections around the enseke is like in prison. When we do laparoscopy, we see adhesions. The enseke wants to move. It's like a snake. It moves like a snake to facilitate the egg and the sperms to move to where they are supposed to be. But once they are compromised, this process cannot happen. And when the broom, which we call the cilia, is gone, plus the fallopian tube cannot do its peristaltic work, things fail.
So this lady's question is...
Yes, I see that. You see, that's what we are talking about. That is exactly. The cilia facilitates the sperms and the eggs from moving.
Wow, that is so nice, Doctor. The last one is, I got an ectopic pregnancy in 2021, but since then, I get in my periods and have small bleeding and sometimes go in periods once in a while. What could be the problem? She has also failed to conceive, still ectopic. Yeah.
2021, this is 2024.
Yes.
You need to come. We can address. Now, I just briefly, I want to bring this, why we are getting so many tubal disease, tubal damage. This is what society is going through. There is what we call chlamydia, an infection. Chlamydia is a silent killer.
What is chlamydia?
Chlamydia is a bacteria which is sexually transmitted.
From one partner to the other?
Yes.
Okay.
So we at university, you are on a sexual network, or you are a young lady, you're on the sexual network. And because you can count your periods, you don't get pregnant. Or you have P2, these pregnancy prevention pills. You swallow it, you are safe. No one says you are not pregnant. But chlamydia is there. So you finish education, you finish school, you want to get married. The tube is damaged. You have dodged, you have hidden that part of yourself of having multiple sexual partners. From your partner.
Everybody looks at you as the most perfect,
you have been perfect. But the story, the fallopian tube will tell us.
It's the opposite.
Yes, that now you've had maybe an issue with chlamydia or gonorrhea, and now the system is blocked. So you come, you wed, plus wedding. And of course in our culture, after wedding, even after 1 month, they ask you, are you spitting? Yeah. So one of the things I really encourage people is there is really no trophy in having sex every now and then. No one will give you a trophy. if you can try and push yourself and keep yourself for marriage, it will save you a lot of trouble.
A lot of trouble, true, and expenditure at the same
Yes,
time.
yes.
Thank you, Doctor. Today's questions are here, Doctor. Good evening, Doctor. Just wanted to ask, can you notice a 1-week pregnancy with a tester or home kit? Can it be 2 clear lines, something like that?
1 week, no.
1
2
week.
weeks.
1 week cannot. Okay, and she said 2 weeks, 1 week. 1 week.
No, 1 week is too
Yes,
early.
it
At
is
least
1
the
week
earliest
here.
we can say is 10 days. That is even blood.
Okay.
But we would prefer probably 13, 14 days.
Okay.
Yes.
Okay, we have another call on the line. Bethan TV, good evening.
Good evening, how are you?
I'm fine, thank you. How are you?
I'm okay.
What's your name?
My name is Rita.
Rita, where are you calling from?
I'm calling from Global.
Yes, Rita. How can we help you?
Yeah, I just want to thank the doctor.
You're welcome, Rita.
Yeah, I was one of his patients.
Okay.
Yeah, so Dr. Phil, I want to thank you so much for helping me. Now I'm a mother for the 1 year. So thank
Wow.
you so much.
Thank
Really
you.
happy.
Thank you, Rita.
Yeah, my question is, now I want to consider again.
Okay.
Should I go back on the drugs? Should I wait? Or I should start taking them as I'm still breastfeeding?
Thank you so much, Rita. Yes, I think Dr. is going
Come
to get
and we
back to
talk
you.
and we reorganize the system for twins now.
Thank you so much, Dr. Rita. Doctor is saying go and you talk and you reorganize another plan now, this time for twins. Yes, another call on the line. Good evening, Bethan TV.
Yes, good evening, madam.
How are you?
I'm okay. You are talking to James from Magayaza.
James, yes, please.
Yes, and thanks for the show.
You're welcome, James.
I would like to know what could be the cause. My wife has ulcers.
Okay.
But every time she gets in her feet,
Mm.
and when she's getting low, she always feels too much pain.
Okay.
So I would like to know what could be the cause.
Thank you so much, James. Doctor is here to get back to you. Yes, James is saying the wife has ulcers. We have another caller before we get to James. Good evening, Bethan TV. Hello. Good evening, dear. I think we're losing them. Sorry, I think the network.
Yes.
Someone is on there. Medical Minds, hello. Hello. Sorry about that. Yes, please.
Good evening.
Good evening to you. How are you?
I'm okay. I'm called Martha from Kasuri.
Martha?
From Kasuri.
Yes, Martha, go on with your inquiry.
I was inquiring of, can taking pills that reduce blood flow during periods cause fibroids or infertility?
Thank you so much, Martha. Thank you. Martha, we have another call on the line. Bethan TV, good evening.
Hello.
Hello.
How are you?
I'm fine, thank you. How are you? Can you reduce the volume of your TV set down a little?
Yeah?
Can you kindly lower down the volume of your TV set? Yes, go on. We can hear you now.
Now?
Pardon? Good evening to you, dear. We can hear you. Sorry about that. Yes. Let's start with James from Gayaza.
Whether the wife goes into her periods.
Yes, the last caller on the line. We have a lot of questions to answer. Bethan TV, good evening.
Yes, good evening.
How are you, dear?
I'm okay.
Who is calling?
I'm Jane calling from Mukono.
Yes, this is James?
Jane.
Jane, yes, please.
Yes, thanks for your people's service. I wanted to ask the doctor.
Please go on.
I'm 45 years old,
Okay.
but for the last 3 years, I don't see my periods. And when I tried to go to the hospital, they said I had the eggs and I was supposed to keep seeing, but it's now like 3 years I don't see periods, I don't have any issues, I don't know what to say.
Thank you so much, Jenny. Sorry about that.
Okay.
Last caller, Bethany TV, good evening.
Yes, good evening, Bethany TV.
Hello, how are you?
I'm okay, how are you?
I'm fine, thank you. I'm Teacher Zita. What's your name?
I'm Editor from TV.
Editor. How are you, Editor?
I'm okay.
Yes, dear.
Yes, my question is about my sister. She's around 40 something.
She's around 40?
40 something.
Okay.
And then she wants a pregnancy. Her last birthday is now 8 years.
Okay.
But she has done all the tests, and then they told her her eggs are We've tried the folic acid tabs naye yakagabamenya.
Omwana agaanye okujja.
Omwana agaanye okugamba amaze kuwala agenze naye ayambiddwa atya.
Kale Editor, omusawo kakuddemu, weebale nnyo tukubirako.
Thank you so much.
Okay, dear. Doctor, you have a lot of questions and messages. Please keep sending in your messages on WhatsApp. In case we don't read them today, next week is still a week. We can still start from there. We start with James from Gayaza, whose wife has ulcers and we have just a few minutes, Doctor. Very few minutes.
Yes.
Yes, can just be
quickly. I would want James to bring the madam and we evaluate for what we call endometriosis.
Okay.
Endometriosis is a condition where every time a woman goes into her period, she gets very painful period, and she can also feel pain, either like ulcer pain, or some even feel pain in the chest, some feel umbilical pain. So if you're having painful periods plus pain in any other part of your body, you are most likely dealing with a condition called endometriosis.
Thank you.
So let James come and we rule out that disease.
Thank you so much, Dr. Martha was saying she takes pills. I've forgotten the question a little bit.
Yes, she says, can pills make someone develop fibroids? No.
Okay.
Martha.
Thank you. And then Editor is saying the sister is 40 something, the last born is 8 years, but she has failed to conceive. How can she be helped?
Yes. It is, I always find it a little bit, I would say maybe it's unfair on the side of a woman, especially in the corporate world now, that you finish school and you want to wait and have children. But science tells us that from 35 years onwards, the egg reserve starts to go down. By 40 years, it goes down.
Completely down.
By 45, the chance of getting pregnant is really low.
Low.
Or if you got pregnant, the eggs are there, but technically speaking, most of them have abnormalities. So the body goes and picks, and maybe a pregnancy happens, but realizes this baby has abnormalities, and they release it out. So
thank you so much, Doctor.
In most cases, it is age causing issue. And for my sister, who is also 40 and says she has stopped seeing her periods, I think she needs to, because when you don't
She's
see
45 years old.
Yes. If you don't see your periods, we are having issues with hormones. Either the hormones are not balanced or the egg reserve is down.
Okay.
And therefore, if she has a fertility desire, please come. We have a solution for these people.
Thank you.
Yes.
Thank you. Thank you so much. You've answered what I was going to ask you. Yes. Hello, Teacher Zita. I'm Emily from Mukono. I would like Doctor to explain more about the rhesus factor, blood group B and A, and my husband is O+, something like that. Yes. How is that?
Maybe one day you will host one of us to come and really digest rhesus incompatibility, because so many people don't know about it. But quickly, what I can say is, if your husband is negative, don't worry.
The husband is O+.
Yes. I'm just giving a general statement.
Oh, a general statement, okay.
If your husband is blood group negative, don't worry. You are not affected. But if you are the one who is negative as the woman, and your husband is positive, now when you get a baby, the baby has a chance, if the baby is positive, therefore the next babies that come, if you don't get immunized, because this baby is like a foreign thing in your system. Yes, because you're negative, the baby is positive. So that's like saying the two don't attract.
They don't
yes,
align with each other.
They don't align with each other. So your body wants to kill that baby.
Really?
Yes. Or releases chemicals to attack that baby. But we have drugs that you can inject during pregnancy and immediately after birth that will tell your body, no, this is your baby. Don't kill.
Safe. Yes. Thank you. Thank you so much, Doctor. Hi, Bethan TV. Are ovarian cysts dangerous when not treated?
There are so many types of ovarian cysts. So if they are classically, I would call them non-cancer and cancer. If they are non-cancer, they are not harmful unless they complicate.
Okay.
But if they are cancerous, they can be a problem. So what you need to distinguish is what is the nature of ovarian cyst. Okay. Many people in reproductive age have what we call follicular cyst, which is an egg which has failed to burst. When the egg has grown to a particular level and it has not, because the egg is supposed to grow and burst to release the yellow part. What gives pregnancy, like for chicken, is the yellow part of the baby.
Like the yellow yolk?
Yes.
So we also have that in human beings?
Yes. So it is that yellow part which is supposed to burst and form a baby. If the egg is not bursting, it forms a cyst. It grows bigger than its capacity.
Okay.
So eventually it really bursts because it cannot stay for long. So
thank you.
Most of them are harmless, but please come and get it analyzed.
Okay. There is a burning question here. I think Khan has given us just some 3 minutes. Hello, Bethan TV. I'm Paul. I have been having pain. Thank you so much, Khan. He's saying, hello, Doctor, I'm Paul. I've been having pain while passing urine for 2 years now. But when I went to check, I had nothing. Even the culture procedure did not show. Wow. This is Paul. Pain while passing urine, 2 years now. He went for the test. Yes, but they're not showing.
Maybe the test is not urine. Because urine is a product, it just passes through. You might not see the kind of things he's describing is structure. Like the gadget is having a problem. So you might not see water is passing. You might not see that the pipe has a dent. The water just passes. So let him go and do what we call like a cystoscopy. This thing, it looks through the urinary system to see where the issue is. So to see a urologist, a qualified urologist, to help him go through this.
Okay.
Yes.
Thank you. There is another message is coming in. Good evening, Doctor. Thanks for the program. Josephine from Chireka. Doctor, I have 4 children and I don't want to add more children yet. I've tried almost all the family planning methods and they seem not to work for me. Please help me. She doesn't want children anymore, but it seems she keeps conceiving. She's too fertile?
Let her come and we clip the tubes.
Oh, okay. Thank you. I think you've had that, Josephine. I think you've had. Get time and go to Bethan TV and you get helped out. Where are we? We have a lot of Harriet from Mokono. Is it advisable to take collagen peptides for face wrinkles and after how long?
I would direct that question to a skin doctor.
Okay.
Because collagen and face wrinkles, this is a beauty. So please see a skin specialist and see whether the two have a connection.
Thank you so much. Yes, we have a caller. We have a caller on the line. Good evening, Bethan TV.
Hello.
Hello.
Good evening.
Good evening to you. How are you?
I'm okay.
Yes.
Julie.
Yes, Judy.
I'm 23 years.
Yes, please.
That I have been getting miscarriages.
You've been getting?
Miscarriages.
Miscarriage
Okay, okay.
for 2 times,
Sorry.
but pregnant, it goes to 1 week. It doesn't go beyond 1 week. So I was asking, what is the problem?
Thank you so much, Judy. Doctor has got you clearly. Yes, doctor. 23 years old, thrice miscarriages. What could be the challenge?
Sorry about the miscarriages. It is very painful.
There is another caller before we talk to Julie. Good evening, Bethan TV. Hello.
Hello.
How are you? How are you, dear?
Okay, how are you?
I'm fine, thank you. What's your name?
Well, I'm just happy to start through,
That's good.
but I have a problem.
Please, go on.
I got pregnant. It's now 1 month, but
You don't?
when I
You got
overwork,
pregnant. She's now
I
1
get
month.
blood, and sometimes I get stomach pain too much. I don't know the reason why.
Sorry about that.
I
Okay.
want to know why. Like beginning.
Kale, thank you. Yes, let's start with Judy.
Yes.
Miscarriages. The 23-year-old girl.
Yeah, miscarriages are a painful thing, but there are so many reasons why a lady gets miscarriages. It could be a problem within the womb. It could be the eggs and the sperms have issues. It could be that the pregnancy has abnormalities. So we can troubleshoot and find out where exactly the issue is
coming from.
Yes,
Okay.
and give her the opportunity to have children. So
Hello.
Thank you. Thank you so much. You have another call on the line. Caller, good evening.
Hello. Good
Hello.
evening. This is Ruth from Kaba.
Yes, Ruth.
Yeah, I wanted to know what causes pain in my left side in the lower abdomen.
Are you expecting?
No, I'm not expecting. I'm trying to conceive.
How long have you been having that pain?
It's going 2 years now.
Sorry about that, Ruth. Thank you, Kale. Yes, before we get to Ruth, can we answer this lady? Yes, she's pregnant and she gets pain and blood, especially when she works a lot.
Yes.
Or she does house chores. What could it be?
I would encourage her to come and we do a scan. We see how the baby is. We can also look into the reproductive system in the vagina. Sometimes inside the vagina, there are wounds. Yes, so when you work, you do, then it starts to kutonya a little bit. So I encourage her to come.
Is that an infection? Is it a
Yeah,
disease?
it could be an infection,
okay.
cervicitis, or sometimes there is a transition. Many women get early bleeding in early pregnancy, and we really fail to find a reason, and eventually it stops.
Okay.
So let her come, we do a scan, we also examine down, and we see where the issue is.
Thank you so much, Doctor. Ruth, with the pain in the left abdomen?
Yes, 2 years, Ruth, you should already have gone to a hospital to find out why you are not conceiving, because that could be a problem with your fallopian tubes.
True.
Yes, if you're having pain on your left side and you're also struggling to conceive,
sorry, we have another
could be
caller.
a tubal issue.
Okay. Sorry, we've lost her. Sorry. Yes, it
yes.
is problem
So
with the tube.
that is a telltale sign that probably the fallopian tubes have an issue.
Thank you so much, Doctor. Another caller before we read the messages. Caller, good evening.
Hello.
Bethan, good evening. Yes, please.
Good evening, doctor.
How are you? This is Chazita. Doctor is listening to you.
Okay, is it normal to feel pain, lower abdominal pain for 2 weeks before menstruation?
Yes, it can happen. We call it premenstrual syndrome. Okay, you have not given me a lot, but many women can have what we call PMS, premenstrual syndrome, where they have a pain before periods.
Okay.
And eventually when the periods come, the pain goes away.
So like the body is preparing.
Yes, the hormones are trying to reorganize themselves.
Okay.
And
thank you. Another call on the line. Bethan TV, good evening.
Good evening to you. Thank you for this show. I'm kind of inquiring if we have different blood group with my mom. Does it affect conceiving? They're both compatible. Yes.
Thank you so much. Different blood groups.
Different blood groups cannot really stop people from conceiving. There should be another reason, which is there are people who have A, B. We all have different blood groups in this. Okay, we might have O get married to BB, but you cannot determine whether you got unless. But different blood groups does not stop people from getting.
Thank you so much, doctor.
There should be another reason.
Okay. Medical Minds, thanks for the show. However, I've missed this medical teaching. When will it be repeated? I think it's always repeated on Monday. The repetition of this show is always Monday. Yes, Monday at 2 p.m. That is when we repeat Medical Minds. Hello, caller.
Hello.
Hello, we can hear you. Good evening, dear. How are you?
Fine, thank you. Doctor did not get my question properly.
Okay.
We are of the same blood group.
Okay.
We're both of O plus.
O plus.
Yes.
Now, can you fail to conceive?
Yes.
Thank you. Thank you.
Yes, it still comes down, my sister, that there are so many women who are O plus. O plus is actually one of the commonest blood groups in the world. So having O plus, both of you could not stop you from getting. At least if you are getting pregnant and you are losing, then we can connect. But blood group per se cannot stop you from getting pregnant.
Thank you so much, Evelyn. I missed my periods, and even when I tested for pregnancy, it was negative. As I was supposed to receive my periods on 22nd Feb. Till now, I don't see them. Adding on to it, when I press my breast, water comes out. What could the problem be?
I'm not seeing her periods.
Yes.
I want to tell a general statement here that periods are controlled by hormones. So when a woman is not getting her periods, it means the hormones are not balancing, generally speaking. So the first culprit is hormonal imbalance.
Okay.
Yes.
Okay.
Then other things can be into the picture, but primarily it is hormones which bring the periods to come and fail to come. Yes.
Okay, thank you so much. Twebaza nnyo empeereza yammwe naye tusaba okutuwa enamba y'essimu ya doctor. Webale nnyo. There's someone who is requesting for your number. But the best you can do is come to Bethany TV and
Bethany Hospitals.
Bethany Hospital Entebbe branch, just before, after Katabi, after the lake. Akasozi ako oba oyambuka on the left ojja kulaba ku kono eddwaliro ya Bethany liri ako kalina wennyini tosobola kubula ndeno ojja kunoonya Dr. Pili bamukulage. You talk to him physically. Pili Patrick, yes.
Or they can come to Luzira branch.
Or you can come to Luzira branch, yes. You see Dr. Anna, but no, if you want Dr. Pili Patrick, you can still find him. Ojja musanga ku ddwaliro wennyini nnyini awo. Ne Luzira osobola musanga. Which days are you there in Luzira?
Luzira, I come to do procedures, laparoscopy.
So you're mainly in Entebbe?
Yes, I see patients from Entebbe.
Yes, Jango Entebbe Omulabe Uterevu. Hello, teacher and doctor. I would like to let you know that even endometriosis causes blockage of tubes. I got the problem of this, and it caused too much pain in lower right side of abdomen when I was still at campus and I was still a virgin. Through many tests, I also did SHG, I think, and I got diagnosed with a blocked tube before having intercourse. So infection is the leading cause, but there are also other causes. Thank you so much. This is Maria. Maria, thanks so much for the research from Chireka, and thank you for being part of the show. Doctor, the last brother is saying, thanks for the show. This is Owor Moses from Kawanda. Can a mother with cervical cancer give birth normally? This is the last question so far.
Cancer, when we start talking about cancer, we talk about stages. Yes, which stage, which in early stages, the cancer specialists will advise. These are mothers who will manage in consultation with cancer specialists. They run their tests and say this is the stage of the cancer, and therefore we can go ahead and have a normal delivery.
Okay.
If the cancer has gone advanced and labor causes spread of the cancer, we recommend sometimes you even deliver the mother by C-section and you remove the uterus. So this is the kind of person you manage in consultation with the cancer gyne-oncologist. So let them not get worried. These gyne-oncologists are here.
They can still give them help.
Yes.
Thank you so much, Doctor. Our last segment, facts. Yes or no?
Okay.
Thank you so much. Family planning is the leading cause of infertility. Yes or no, Doctor?
No.
Thank you so much. The infertility issues is mostly for women. Yes or no, Doctor?
No.
It is for both men or men?
Both men and women.
Thank you so much. Yes, family planning causes a lot of weight gain in mothers especially.
No.
No? Thank you. Family planning causes abnormality in newborn kids.
No.
Thank you so much, Doctor. That has brought us to the end of the show. Thank you so much for being a part of Medical Minds. Let's hear the last remarks from Dr. Peter. Yes, please.
Yes. Thank you very much, Teacher Zita and the whole Bethany TV team, and to our dear people outside there who are struggling with fertility, who are struggling with different challenges. We encourage you, don't die alone. There are facilities, there are doctors who are willing to move this journey, and you receive the joy of your womb. So it is treatable.
Thank you.
Come, we take care of you. Sometimes it takes long and it can be frustrating, but
true.
The dream can always be achieved.
Thank you so much.
Yes.
Thank you. That has brought us to the end of the day and to the end of the show on this Sunday. Tomorrow is Monday. Let's go home, energize ourselves, plan for tomorrow, and we'll go and work from the team. Wherever the nyoko ekubira ku Bethany TV. Musole bulungi.
Bethany TV for health. Are you looking for a platform to advertise your business?